When do you see your GP versus when do you see your psychiatrist? It's not really your problem because it's the GP's responsibility to refer you if they think it's necessary, but I still think it's educational for you to know. By the way, for our foreign or maybe US viewers, GP is what we call family doctors in this country, general practitioner. Firstly, basic psychiatric problems can be dealt with by the general practitioner. So your GP knows a little bit about all types of medicine. He or she is like the jack of all trades. So they can help treat basic arthritis or diabetes or minor depression. However, when it gets complicated and the patient needs ongoing help and they need long-term specialist detailed input, then the GP refers to a specialist, which might include a psychiatrist. So psychiatrists generally have a more intimate knowledge and experience of lots of different medications and more severe psychiatric illnesses. They've often worked on psychiatric wards, and obviously they deal with a higher level of illness. Sometimes people have been sectioned or detained under the Mental Health Act. By the way, I've done a completely different video on the process of being sectioned, what to expect. Go check it out. Also, psychiatrists might be more used to dealing with specialized medications like antipsychotics or mood stabilizers. Your average GP might not have that much experience in that. But then later, if the psychiatrist has stabilized the patient and they don't need such a high level of support anymore, the psychiatrist can discharge them from their service back to the care of the GP. Okay, Dr. Das, stop beating around the proverbial bush. What are the specific situations that a GP might refer me to a psychiatrist? Chill out, I was just about to get to that. So if you have a very distressed patient who's easily agitated, it might not be suitable for them to go to the environment of a general practice surgery because it might disturb other patients. So they might be more suitable for a psychiatric clinic. Also, in the UK, GPs are pressed for time. So generally they have around 15-minute windows to see the patients, including taking the history, examining them, writing up the note. Not a lot of time, and they can't go into much detail, whereas a psychiatrist can. Also, in a psychotic illness, as opposed to a neurotic illness, it's more likely the GP deems this to be out of their area of expertise. So psychotic illnesses are things like schizophrenia, where people suffer from delusions and hallucinations, out of touch of reality. See my separate video on schizophrenia if you want to know more about this. Whereas the neurotic disorder tends to be things like anxiety or depression, where the patient understands that they're ill. So in psychosis, they often don't have insight, and therefore, if they don't have insight, they don't believe they're unwell, much harder to treat. For example, they might not take their medication. Another situation is if there's a high level of risk, such as deliberate self-harm or suicide or even violence. It's very likely that this person might need to be hospitalized, even sectioned. I can talk about this, that's literally what I do for a living as a consultant forensic psychiatrist. Also, if a GP has tried to treat a patient but is struggling, so for example, if they've prescribed lots of different antidepressants and they don't work, that's another reason to refer them to a psychiatrist who might try different medications, combinations, higher doses, unusual medications, etc. By the way, dear viewers, I would like to know your stories about your psychiatric treatment, either with your general practitioner or your psychiatrist. I would love for you to share your experiences. If you feel comfortable, let me know in the comments. Hello, cruel world. What you just saw there was a tiny little tantalizing taste, kind of nutty, of a much longer episode. You should go check it out if you're interested. The link will be in the description below. If you're a fan of either true crime or mental illness, or the crossover between the two, then you've got to go and check out my main YouTube channel, A Psych for Sore Minds. My name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. My channel covers a whole range, a smorgasbord of topics related to true crime and mental illness. For example, high profile true crime cases with my own kind of personal psychoanalysis of individuals. I discuss issues related to criminality. I discuss individual diagnoses. I give advice about psychiatric problems. I interview ex-patients. I do a lot. There is something for everybody on my channel, and I implore you to go and check it out. You can even steal some of my ideas, palm them off as your own to impress your friends and impress people at dinner parties. It's all good. I've got you back. Until next time, stay euthymic, check out my channel, and please do not forget, I love you.